Okay, so Dear Evan Hansen is a movie about a teenager who writes to himself motivational letters in order to manage through an undetermined mental illness. This movie follows his story of how he struggles through many dramatic life changes while also dealing with his mental health disorder. Essentially, the movie starts in the beginning of the school year where Evan broke his arm from an accident over the summer. He receives um, therapy, and one of his coping skills is writing himself inspirational letters. And to force himself to interact with students on the first day, he tries to get someone to sign his cast, but he is not going to be able to because of his undetermined mental illness. Connor Murphy, a person who considers himself a pariah, like he says, he relates to Evan, signs Evan's cast at the library. But Connor sees one of Evan's notes and he thinks that this is a prank on Connor or to himself. So he runs away really upset while Evan tries to explain the situation, but he can't because of his mental disorder. So the next day, Evan comes back to school and he finds out that Connor took his own life because of this. And now Connor's parents think that Evan and Connor were really good friends because the note is addressed to Evan Hansen, right? Hence the title Dear Evan Hansen. And essentially, the rest of the story is Evan not being able to speak up because of his mental health disorder on the situation, and everyone just kind of portraying him as this big friend of Connor's. So I believe that Evan Hansen is struggling with the mental health condition of social anxiety disorder or sociophobia. So one of the DSM-5 criteria for social anxiety disorder is persistent, intense fear or anxiety about specific social situations because it is believed that he may be judged, negatively embarrassed, or humiliated. And every single time Evan approaches someone to interact with them, he finds himself having some anxiety about how it's going to turn out or what he's going to say. And he essentially just never is able to talk with anyone because of how overwhelmed he is with fear. So as far as therapy, medications, and assistance is concerned, Evan actually takes a medication every time he has an anxiety attack, and this can be assumed to be a benzodiazepine because he uses this to essentially relieve stress every time he has some sort of anxiety attack. He also sees a therapist, which actually one of the coping skills that they're trying to work on is the entire premise of the movie, which is writing himself letters that start out with Dear Evan Hansen. And as far as the actual treatment is concerned, I don't think it's working that well because it is later revealed in the movie that Evan actually tries to take his own life. Over the summertime, that's how he broke his arm, was he actually tried to jump off a tree to take his own life. Other instances in the movie where we see symptoms of social anxiety disorder is displayed throughout the DSM-5 criteria. So first one is the avoidance of anxiety-producing social situations. We can actually see Evan in many portions of the movie avoiding talking to people because of how nervous he is throughout the entire time and how overwhelmed he becomes. Excessive anxiety that's out of proportion to the situation. So we see Zoe Murphy, Connor's sister, interacting with Evan in the beginning of the movie, and Evan is just frozen, not being able to talk because of how overwhelmed he is with fear and anxiety of saying something wrong to Zoe. So he just stays still and does not say anything, while Zoe is baffled and just does not know what to do as well. So she walks away, and then Evan also walks away. Finally, we see anxiety or distress that interferes with daily living. In this instance, we actually see more portions in the movie where Evan forgets to eat food or does not order food because of how overwhelmed he is with talking to people over the phone, essentially with people with delivery. So he does not eat food at all sometimes because of how stressed out he can become with interacting with people. And then we also see how Evan does not call his mom in times because he does not want his mom to react to him being stressed out and facing anxiety. So he just does not call his mom for any social support whatsoever. And finally, something that is obvious with social anxiety disorder is that he does not have effective relationships past his family. He does not have any friends, and that is because of his overwhelming anxiety that he faces with social interactions. According to several textbooks, the first type of drug that is prescribed to social anxiety disorder is SSRIs, or selective serotonin reuptake inhibitors. We also see the prescription of paroxetine, which is Paxil, or sertraline, or Zoloft to those who suffer from this condition as well. Another option that can be given are norepinephrine reuptake inhibitors, such as venlafaxine or Effexor. This can be given for social anxiety disorder. Other drugs can be clonidine or propranolol. These can be given before a social anxiety causing stressor is there, so this can be taken preemptively. And as far as therapy is concerned, individual therapy and goal-setting groups can be beneficial for Evan. It's also important to see how Evan tolerates groups during milieu, and if they prefer individual activities based on their anxiety level. And essentially, patient social interaction can possibly increase and be tolerated further as he progresses through therapy. Essentially, the goal is to have systematic desensitization and exposure therapy for Evan. I think something that I can learn from this movie in my future practice is just being able to notice how social anxiety affects a person, and how sometimes it can be frustrating to interact with patients who have social anxiety because they are just so overwhelmed with feelings and do not like interacting with people, but that's essentially it. I think in my future practice, I just need to be more patient with individuals who have social anxiety in order for us to make progress in our care. Essentially, being more understanding of people who face social anxiety can help me better give care and be more effective in treatment as we move forward. So as far as recommendations are concerned, for the short term, I believe that Evan should essentially give himself more time to adhere to his medication regimen of SSRIs and taking his PRN benzos if he needs them, and then taking his propranolol every time he thinks he's about to face social anxiety. Essentially, adhering to medication regimen is something that's really important for anyone that faces anxiety. And he just needs to make sure that he keeps seeing his therapist, because I know throughout the movie that he misses appointments every once in a while because he does not want to interact with his therapist. For a long-term goal, I think Evan should be able to create a social relationship past his family. So essentially being able to just make at least one other friend besides his mom is a good goal. It's a hefty goal for Evan, but it's a step towards essentially remission from his social anxiety. And then another thing is that he could most likely find some more coping skills in order for him to overcome his social anxiety. So essentially reduce the amount of stress that he faces whenever he does face social anxiety. I think overall, I'd probably say my nursing diagnosis for Evan would be impaired social interaction related to anxiety felt towards social interaction, as evidenced by feeling anxious and fear before, during, and after social interaction. As far as nursing interventions are concerned, I should be able to identify with Evan his symptoms whenever he experiences them, and whenever he feels to begin to feel anxious around others. So by doing this, I am able to find certain triggers for Evan, and we can possibly work on how we can overcome either the triggers or the anxiety itself, and just so we can be able to work further into reducing his anxiety overall. Number 2, I should be able to ensure that our goals are realistic and set, because this is the only way we're going to reach our goal. There's no sense in setting a goal that sets us for failure, and this failure can honestly lead to Evan feeling a little more despondent than he already does. So by setting realistic goals, we are able to achieve them and move forward with success. And finally, with our patience theme here, we can be whenever Evan is not able to respond to me verbally or in a coherent manner, I should essentially spend frequent short periods of time with Evan instead of long bouts of assessments. Essentially, this is just to keep an interested presence, so I can provide Evan with a sense of being worthwhile whenever I'm speaking with him instead of not being able to develop progress. Should be the first person movie, but I move this to the end of the video. And what is my opinion of the movie? Did I like it? Did I dislike it? I love Dear Evan Hansen. So they take a story of a teenager who faces mental illness and how he deals with life. Some of these instances do happen in real life where a friend essentially commits and takes their own life, and that can be very devastating for someone, and then they take a spin on it and throw mental health disorders in there, and this becomes an interesting movie to watch because you get to see how people with mental health disorders deal with life stressors. And it's interesting to see that they bring light to mental health disorders in general, because not a whole lot of movies right now are doing that, and that is why I love this movie, just because they show a realistic tone and how this sets a theme for us for in the future for movies. Overall, I love this movie, and in summary, Dear Evan Hansen is one of those movies that focuses on mental health, and this is how, as a nurse, we relate to mental health disorders and try to empathize with our patients, and in order for them to essentially feel remission and receive our care, we need to be more understanding of what it is like, and looking at it from a movie perspective really shows us a good way of how a point of view of how mental health disorders are.